Okay, good afternoon to all. Going to Material Medical and Keynote Masterclass course. Today we'll be dealing with Argentum, Nitricum, and I am Dr. George Steben. Introduction being common name, that is silver nitrate. Chemical formula is AgNO3. Okay, the new method have a touch strength of 1/10. Physical properties, it's just like your Argentum met. Here it's not a metal, it's a compound, so it is having an odorless white crystals, and it is soluble in water, a little more soluble in boiling water. Okay, so yeah, it can impart a yellow color also after some processing and all, but generally it is white colored crystals. Constitution, always think of Argentum nitricum on seeing a withered, dried up, old looking patients. So what did I say in the previous class of Argentum met? We know there is a withered, emaciation, thin kind of constitutions running in Argentum group. So here also it's the same, dried up, old looking patients. So old looking patients, you have to remember Argentum nitricum also. You can think of lycopodium here, you can think of abrotanum here. So all these things shows that how dried up these patients are. Okay, and thin scrawny patients, you can think of sickle core. Now I want you to remember this scrawny word so that you can identify sickle from the question. Okay, so withered, dried up, old looking patients is Argentum nitricum. Thin scrawny patients are sickle core. Okay, so why this lady is biting her nails? Because she is having anxiety. So apprehension when getting ready for church or opera, and what happens? Diarrhea sets in. So diarrhea, apprehension, diarrhea. So that is one important remedy, that is Argentum nitricum, the other being Gelsemium. So all these two remedies have this apprehension, diarrhea. Okay, now diarrhea have a particular character which we will be discussing later. Time passes slowly. Okay, time passes slowly. You can see in cannabis indica, you can see in medrenum. So you have a lot of remedy. We have already discussed those things. I'm not going into that because it's very big slides. So I'm rushing off. Okay, impulse, want to do things in hurry, must walk fast, is always hurried, anxious, irritable, and nervous. So you have comparison remedies like aurum and Lilium tig, because Lilium tig is also a very hurried person. Okay, mind, it seems as if house okay, sorry for one point kept like that, sorry. So mind, it seems as house on both sides of the street would approach and crush him. So it's all these anxiety and apprehension symptoms. Impulse to jump out of the window or impulse to jump off the bridge while crossing a bridge or a high place. Okay, so before we were seeing vertigo on looking running water, it was Argentum met. Vertigo on crossing bridge, you can think of Ferrum met, and now see impulse to jump off from the bridge, you can see Argentum nitricum. Okay, physical generals, acute or chronic diseases from usual long continued mental exertion. Okay, emaciation progressing every year, most marked in the lower extremities. Now lower extremities emaciation, three remedies we have already discussed: abrotanum, ammonium, and now that is your Argentum nitricum. Longing for fresh air, just like your amyl nitrosum, pulsatilla, sulfur. Even your Argentum met also have longing for fresh air. Okay, in your boric it is written. Chilly when uncovered, yet feels smothered if wrapped up. So see what is the condition here. Chilly when uncovered. Okay, chilly when uncovered. But then if due to this chillness, if he wraps up, he feels smothered. So there is a desire for fresh air. Now this is a remedy that craves sugar, and it is coming under the trio of craving sugar and sweets. Pain increases gradually and decreases also gradually. Now again, not going into the list of remedies right now, because as I said, the number of slides in this remedy is very long. So please remember this, have this particular description. Pains increase and decrease gradually. Okay. See, this is a footballer, particularly Griezmann of France team, and I again would like you to remind that I'm a football fan, so I'll take a little comparisons from football. I'm sorry for that, who cannot relate to it. So I want you to remember his head. See the bandage, the thing he have tied to his head. So here you have a headache that is better by tight pressure and bandaging, just like you can see in Epis and Pulsatilla. Argentum met has this marked symptom of better by tight bandaging. A headache, it is congestive with fullness and heaviness with a sense of expansion. Now, sense of expansion we discussed in Argentum met also. Okay. Now we know Argentum nitricum has a lot of gastric issues, so it can have a gastric headache of literary man and from dancing. So headache from dancing can come up as a question, and the answer should be Argentum nitricum. Okay. Hemicrania, pressive screwing in the frontal eminence of temple. Okay. Ending in bilious vomiting. So this looks like a little of migraine. Okay. But the location looks like more of this bandage. The front occipital location looks like a tension headache, but ending up in bilious vomiting, that looks a little bit of your migraine. Okay. Yeah. So I want you to remember it can be a gastric type of headache. From dancing, it's congestive type of headache. The location you have to see, it's of a frontal eminence of temple. It's better by pressure or tight bandage. It can end in bilious vomiting. The eyes, Argentum nitricum is one of the most important remedy for conjunctivitis and ophthalmia neonatum per se. Because ophthalmia neonatum, now recently the incidence is very low because of the advanced care in pediatric side. But then before it was very prevalent symptom in newborns, because gonorrhea was very prevalent, and when the child comes up through the vagina of an infected mother, you can expect ophthalmia neonatum to happen, because it is also caused by Neisseria gonorrhoeae. Now the features of conjunctivitis. It will be read how it is described like a raw beef, discharges profuse and mucopurulent. Okay, the cornea becomes opaque, ulcerated, because again ophthalmia neonatum has a corneal ulceration complication. Okay, and it is agglutinated in the morning. So whoever had conjunctivitis in the past would know how difficult conjunctivitis is, because you cannot open your eyes because of the pus that is formed. Now all this debris will be there, and agglutinated in the morning. You have to remember some remedies like Epis, Mercor, Rustox, even I think you have Bovista, I think, I'm not sure, but no, not Bovista, sorry, Borax. Okay, yeah. So eye strain from sewing, aggravation in warm room, better by open air. See, so eye strain from sewing, you have to remember Natrium and Ruta here. Okay, and diseases due to defective accommodation. So you have a lot of symptoms in eye. Okay, yeah, I'm not giving the each and every point. I'm not reading. Okay, 200 or 1M potency in watery solution as a topical application has relieved when crude silver nitrate have failed. Okay, and now what is this? This is something you can relate to a splinter in throat. Okay, sensation of splinter in throat when swallowing. You have a lot of remedies like that. Dolichos, Hepazole, nitric acid and Cilicia. Catarrh of smokers with tickling as of hair in throat. Tenacious mucus in throat, obliging them to hawk and cause hoarseness. Okay, so there we had viscid gelatinous mucus like boiled starch, jelly-like mucus, all those things. Here also we have a similar picture, but not much. Okay, instead you have something like a wart-like excrescence extending down, involving larynx, especially in clergymen or lawyers who use their voice too much. So the affection or the people are affected are same, the presentations can be different. There it is total loss of voice. Here you have a little more mucus and some kind of warty excrescences that you can see in the throat. Okay, yeah, and sensation of splinter in throat is very important for Argentum nitricum. GIT, you have craves sugar, child is fond of it, but diarrhea results from eating. See, so you have cough aggravation sweet, spongia. You have diarrhea from sugar or sweets, you can think of Argentum nitricum. Belching accompanies most gastric ailments. Very important symptom. I think it is given in bold in keynotes. Flatulent dyspepsia, belching after every meal, stomach as if it would burst with wind. Belching is difficult. Finally, air rushes out with great violence. So, imagine the level of flatulence or the air buildup in the abdomen of such patients. Okay, so please remember, Argentum nitricum is somebody who takes in tension very easily. So, I think all these gastric things will occur easily in a tense, such tensed persons. Okay, so they can come up with, headaches. They can come up with, dyspepsia, diarrhea, all those things. Okay, so imagine Argentum nitricum in such patients. See the craving for sugar, and again in GIT you have green mucus-like stools with flakes. How is it described? Like chopped spinach. Very important term, because another question is coming of few people. Turning green after remaining on diaper, after drinking, after eating candy or sugar. Masses of mucolymph in shreddy strips or lumps. You can again relate to Asarum europeum with much noisy flatus. So once the person goes to toilet, you can hear a lot of noise when that person goes to toilet, because there is a lot of flatus. The stool is described green like chopped spinach. You have aggravation sweets. Fluids go right through them. Diarrhea as soon as he drinks, because another important symptom you can see in Rs, prototic thrombedium. Okay, so all these things are very frequently coming up, and gastritis of drunkards. All these symptoms you can see in Argentum nitricum GIT. Very important section. So I have taken few symptoms from Boric and Nash also. Urine passes unconsciously day and night. So that's something that is your enuresis part. You have nocturnal and diurnal enuresis. Here, emissions of few drops of urine after having finished. So that you can see in old age people having prostatic complaints. And there is divided stream and early stage of gonorrhea. What I want you to remember is Argentum nitricum is having a psychotic background. So gonorrhea is there. Again, relate to ophthalmia neonatal. Weak pelvic muscles, yeah, it is there because that causes incontinence of urine. Male, you have impotence, erection fail when coition is attempted. Okay, so in MET, Argentum MET, that was emissions without erection. Here it is erection fails when coition is attempted. Okay, so when try to copulate, the person have no erections, and there is a want of desire here. Okay, so here also there is impotence. In females, there is sensation of splinter in or about uterus when walking or riding. Coition is painful in both sexes, followed by bleeding from vagina, as well as you can see in nitric acid. There is metrorrhagia, that is intermenstrual bleeding in young widows, in sterility, with nervous erethism at change of life. Okay, so these things you can think. Again, please remember, it can also be given in people who approach the menopausal side. So that's why there is young widows, in sterility, as well as in the change of life. Okay, and painful affections of left ovary, again being in the same level of Argentum MET. And there is gastralgia at beginning of menses. Okay, so these symptoms you can see in keynote as well as Boric. I've kept a compilation of both, and I'm saying that I think I cannot finish the whole slide, so I'm taking a second part of it. Okay, so let's continue in the next part. Okay.